Oh, hi. I want to start with you, please, Matthew Guy. In respect to healthcare, you've mentioned putting money towards healthcare. If you could please elaborate what you intend to do. And to Daniel Andrews, you've mentioned some things that you're going to look at, but I'd like more detailed explanation as to exactly what you're going to spend your money on as well, please.
Thanks, Paul. Okay, it's a long list. So in reprioritising money from the suburban rail loop, that means we've got a number of billions of dollars to put back into building health infrastructure. So let's start with infrastructure. That means we can build a new hospital in Melton, for instance, which is Melton and Wyndham together are going to have the population of Canberra fairly soon. So that hospital needs to be funded and built. A Royal Children's Hospital in Werribee, one of the fastest growing areas for kids in Australia. Hospitals in Mildura, in Wodonga, in Warragul, smaller places like St Arnaud or Daylesford, Mansfield. We can put the infrastructure money into hospitals which some of them have got leaky roofs, some of them have got mice running through them. I mean, they need to be rebuilt. And this is a moment in which we've got a pool of money and we can reallocate to do that. On top of that, we can hire another 40,000 new nurses and midwives over a 4-year period to get more back into the system. So we're replenishing those people who are leaving. On top of that, because we've got that money which we've reprioritised, some of those hospitals can be training hospitals as well. La Trobe Uni found that where people train in the health system, 80% of the time, that's where they stay. So we've got training facilities, for instance, in Shepparton, in Mildura, and of course in the CBD in Melbourne. That means we're actually training the next workforce in our hospital system as well. We can put a huge amount of more money into 000 to fixing the problems that are in the 000 network. I mean, it is so important we do this now. And my contention to Victorians, at this point in our state's history, at this time, now is the time when we were told before COVID that we're going to fix the system to prepare us, which is why we were locked down. And we come out of COVID and find the system's worse. Well, I say now is the time for us to fix the healthcare system once and for all. We have a pool of money. I don't disagree that infrastructure is important and one project might be very important, but it's not our priority. Your health is my priority. Saving lives is our priority. Fixing the system should be the priority. That money is there to build that infrastructure, to employ those extra nurses and midwives, to fix 000 once and for all. And that's what I want to make the priority of a government I lead.